Hi, my name is Angela Courgi,
And I'm Merna Seleman.
and today we're going to be talking about common eye infections, more specifically pink eye and styes.
What is an eye infection? An eye infection occurs when a bacteria, fungi, or virus enters the eye, and it can occur in various locations of the eye and can affect either one eye or both eyes. It includes the clear front surface of the eye, the cornea, and the thin, moist membrane lining the outer eye and inner eyelids. And the two most frequent eye infections are conjunctivitis, also known as pink eye, and styes. And throughout this presentation, we're going to go a little bit deeper into the different causes, preventions, and treatments of these two infections.
First up, we have pink eye. Pink eye, also known as conjunctivitis, is an inflammation of the transparent membrane which lines our eyelids and covers the white part of our eyeballs. The pink appearance of the eye occurs because of inflammation of small blood vessels. There's many different causes. I'm going to talk about four, which is viral, bacterial, allergic, and irritant. Causes of viral conjunctivitis. It's the most common type of pink eye. It can be caused by many different viruses, such as adenoviruses. Interestingly, coronavirus, like the common cold or COVID-19, can cause pink eye. It's highly contagious and it often spreads through crowded places. It causes a burning red eye with watery discharge. Next, we have bacterial conjunctivitis. It's an infection of the eye caused by certain bacteria. It can be caused by things such as Staph aureus, etc. This type is more commonly found in children than adults. It's also very contagious and spreads easily. It causes sore red eyes with sticky pus in the eye. Then we have causes of allergic conjunctivitis. This happens when your body reacts to certain allergens. It's not contagious, and it happens mostly to people with other allergic conditions such as asthma, eczema, or hay fever. It can occur seasonally as allergen levels are higher, and this type of pink eye makes your eye very, very itchy, red, watery, and your eyelids may get puffy. And then we have causes of irritant conjunctivitis. Causes from foreign materials include smoke, dust, fumes, chemicals. It's not contagious, and it can happen if contacts are worn for longer than needed and if they're not cleaned properly. It may cause watery eyes, mucus discharge, but usually clear up on their own within a couple of days. How exactly is pink eye spread? It's spread from transfer of bacteria or virus. Therefore, when it's caused by allergens or irritants, it's not contagious unless a secondary bacterial or viral infection ensues. It happens when people are in close contact with one another, such as touching. Germs will transfer from the hand of the infected person, and then once you touch your eye, you'll be infected as well. It can also happen by touching contaminated surfaces, then accidentally rubbing your eye, and it can also be caused by sharing cosmetics. How to stop the spread of conjunctivitis. You want to practice good hygiene, refrain from touching your eyes, don't use the same eye drop dispenser for infected and non-infected eyes. If you wear eyeglasses, make sure to clean them properly, stay away from swimming pools, and do not continue to wear contacts until your doctor says it's okay. And again, make sure to clean your contacts. How to avoid conjunctivitis. If someone you know has conjunctivitis, this is what you should do to prevent yourself from getting the infection as well. You want to wash your hands, use alcohol-based hand sanitizers, wash your hands again after contact with infected person. If you help them instill eye drops, just make sure you're washing your hands continually. You want to completely avoid touching your eyes unless they're washed. And lastly, do not share items with an infected person. Okay. CDC recommends vaccines that may prevent infections associated with conjunctivitis. Although there's no direct vaccination to prevent it, there are certain vaccines that do help to prevent the viral and bacterial diseases that are in association with conjunctivitis, including the vaccines measles, rubella, chickenpox, shingles, pneumococcal, along with HIV. Okay. General symptoms of pink eye. Depending on the cause, there might be other specific accompanying symptoms, but for the most part, the general symptoms that people experience are red or pink color in the white parts of the eye. You can have swelling of the conjunctiva, more tear production, the urge to rub the eye or feeling that there's something in your eye, itching, burning. You may experience some kind of discharge, such as pus or mucus, and you might have crusting on your eyelids. And if you wear contacts, it might feel like they're not fitting in your eye correctly. Symptoms specific to viral conjunctivitis. It may occur alongside symptoms of cold, flu, or other respiratory infections. It tends to begin in one eye, may spread to the other, and eye discharge tends to be watery rather than thick. For bacterial, it may occur alongside an ear infection, occurs shortly after birth, will have a discharge that is thick rather than watery, and you'll most likely have a pus-like discharge, which causes your eyelids to stick together. For allergic conjunctivitis, it may occur alongside symptoms of common allergies, such as itchy nose, sneezing, asthma. It will occur seasonally when pollen is higher, usually happens in both eyes, and it's going to produce a very intense itching, swelling of your eyes. Then we have symptoms for irritant. It will produce watery eyes and a mucus discharge. These usually clear up on their own within a day. However, persistent symptoms may indicate a foreign body can still be in your eye or that you've scratched your cornea. Diagnosis for pink eye. In typical cases, a doctor can diagnose just by asking questions about your symptoms and your recent health history. They most likely can detect whether it's virus, bacterium, allergen, or irritant based on said symptoms. Visits to the office are usually not needed. However, if it makes the patient feel more comfortable, they can see an MD. Although it's very rare, it may be difficult to determine the root cause without lab testing. So how exactly is it treated? Depending on the severity, it may be important to seek medical care. However, this is not always required. In order to treat the symptoms of inflammation and dryness, there are home remedies to alleviate these discomforts. You can use a cold compress and artificial tears, which can both be purchased OTC without a prescription. And you just want to discontinue the use of contacts until symptoms are completely gone. So when should you seek medical treatment? Although some cases don't require it, it's imperative to seek healthcare if you have conjunctivitis, along with any of these following: pain in the eyes, intensity of red color, sensitivity to light, blurred vision that does not improve when discharge is cleaned, symptoms that do not prevail and continue to persist, or if you have a weakened immune system from illnesses such as HIV or others. Medical treatments for viral conjunctivitis. Most cases are mild and go away within a week or so. However, it may take up to 2 to 3 weeks to fully clear up. No drops or ointments can treat it. However, they can be relieved by artificial tears or cool compresses. Medical treatments for bacterial conjunctivitis. For cases of mild, they tend to go away with the use of antibiotic treatments. It'll usually improve on its own within 2 to 5 days. However, it could take up to 2 weeks to completely go away. In some cases, your doctor may prescribe an antibiotic. It will be a topical eye drop or an ointment. These antibiotics will help shorten the length of your infection, reduce complications, and reduce the spread to others. It can become necessary when your discharge of pus is excessive, in cases of immunocompromised patients, and certain bacteria are suspected. Then we have treatments for allergic conjunctivitis. When it's caused by an allergen such as pollen, condition usually improves by removing that allergen from their environment. This isn't always possible though, especially with seasonal allergies. Cold compresses on cold eyes can help with any swelling. Some OTC allergy medications and certain eye drops can help relieve those allergies as they contain antihistamines or anti-inflammatory properties. You can also receive prescription eye drops or a combination of prescribed drugs to help improve persisting symptoms. Conclusion. Although the appearance of pink eye is very concerning, it usually isn't too serious, and it's highly treatable and preventable. Most cases of conjunctivitis go away on their own unless the condition is severe. Getting treatment for bacterial, viral, or allergic cases may help shorten the duration of the infection and reduce your symptoms. Make sure to take the the necessary steps to avoid spreading pink eye so that others do not get it as well.
Okay, so now moving on to styes. What is a stye? A stye is a common eye infection that causes a red, painful, tender lump near the edge of the eyelid. It may look similar to boil or acne pimple, and they're often filled with pus. It's most common to have it in just one eye, but you can also have it on both eyelids, and it usually lasts 1 to 2 weeks. So there's two types. There's an external stye, which forms on the outer part of the eye, either the upper or lower eyelid, and it's mainly caused by an infection in your eyelash follicle. It's the most common type, and you can also have internal styes, which form on either of the inner eyelids, and it's commonly caused by an infection in the inner eyelid gland, and these glands function in producing oils that aid in keeping our eyelids moist. So causes of stye. A stye is caused by a bacterial infection in your eyelid's oil-producing gland in the eyelash follicle. This eyelid oil gland becomes blocked, which leads to a small but uncomfortable bacterial infection, and the bacterium Staphylococcus is commonly responsible for most of these infections. And this is just an image showing a little bit more clearly how an eyelash follicle can be blocked. The symptoms of a stye is a red lump along the eyelid edge near eyelashes, pain in the eyelid, swelling of the eyelid, crusting along the eyelid, light sensitivity, soreness and itching, eye tearing, and a feeling that there's something in your eye. So most of the times people can get confused between what a stye and a chalazion is. So styes and chalazion are both lumps in or along the edge of an eyelid, and they may be easily confused. A stye is an infection that causes a tender red lump on the eyelid, and a chalazion is a lump or cyst in the eyelid, and it may look like a stye, however, they're oftentimes larger and are usually not painful. So just to go a little bit more into the difference between the two, styes are caused by the bacterial infection of the eye. Usually the bacteria grow in the follicle of an eyelash. However, an internal stye is caused by an infection in the oil glands inside the eyelid. Most styes continue to swell and grow for 3 days, and they will then break open and drain, and they usually heal in about a week. Chalazion, on the other hand, occurs when there is blockage of an oil gland in the eyelid. If an internal stye does not drain and heal, it can progress into a chalazion. And it's oftentimes not painful, and it grows too large. If it grows too large, it may affect eye vision. Inflammation and swelling may spread the area to the area surrounding the eye, and it often heals in a few months if there's no treatment. Some common risks are touching the eyes with unwashed hands, having unclean hands when inserting or taking out your contacts, leaving on eye makeup overnight, using older expired cosmetics. Those are a little bit more of the common ones, and then I'm going to go into more detail about the more chronic ones. So styes are fairly preventable and affects people of all races and genders equally. However, because the oil in an adult's oil gland is thicker than that of a child's, styes may be more common in adults than in children. So that implies it's more likely to become blocked. And you're more likely to get a stye if you have specific conditions including blepharitis, dandruff, rosacea, diabetes, or high levels of bad cholesterol. So just to go into a little bit more detail about those, blepharitis is an inflammation of the eyelid that affects the edges of the eye. It can also affect the inner part of the eye, and it's a condition that causes itching, burning, and leads to a sensation that there's something in your eye. And it can lead to the creation of a stye. Next, we have seborrheic dermatitis, which causes scaly patches and red skin. It affects not only the scalp, but also the eyebrows, the face, and the eyelids, and it's the most common cause of blepharitis. Oily secretion, eyelid swelling, scaling, and flaking from this condition produce itching and burning of the eyes and can affect both the upper and lower eyelid and cause a stye. Rosacea is a prevalent skin disorder that causes facial flushing and visible blood vessels. Small pus-filled lumps may also appear. It involves the eyes in that it can cause watery or bloodshot eyes, irritation, burning, or stinging, swollen eyelids, and can also lead to styes. So also diabetes can lead to styes. Your eyelids are also more susceptible to infection, which can lead to styes. High blood sugar can also trigger the development of chemicals that weaken immunological systems, making people with uncontrolled diabetes more susceptible to infection. So poor hygiene. While a stye can produce redness, inflammation, and stinging in the eyelids, touching the region can introduce additional bacteria and irritate the stye and possibly spread the infection. So if you touch your nose and then touch your eye, or touch your mouth and then touch any mucus area and touch your eye, that can possibly lead to a stye. Also, using old cosmetics or sharing cosmetics, just as Angela mentioned with pink eye, can also lead to a stye. And something that I wanted to share on this slide that I thought was pretty interesting is that some people spit in a makeup container to wet their cosmetics, but because there's bacteria in our mouth, that can grow on the cosmetics. And if we put it onto our eye, that's just introducing more bacteria to our eye. So definitely do not spit into your makeup, but that can also lead to a stye. Some treatments, home remedies, you can use a warm compress, apply a warm compress to the eyelid 3 to 5 times a day for 10 to 15 minutes, and clean eyelids daily. You can gently wipe eye discharge across the eyelid with a soapy solution made from half baby shampoo and half water. When you do have a stye, do not squeeze or pop it, do not rub or touch the eyelid, and do not wear any makeup or contact lenses until the area has been healed. In terms of when to visit a doctor, if you have a stye and it seems to persist for more than 48 hours with treatment, it's important to go see a doctor to reduce symptoms and inflammation and possibly spread. So your doctor may prescribe antibiotic eye drops or topical antibiotic cream to apply to the eyelid. The most commonly prescribed topical antibiotic for the stye is erythromycin, and oral antibiotics can also be given. The most effective are amoxicillin, cephalosporin, tetracycline, doxycycline, and erythromycin. And the stye should clear up in about 2 days. If the stye does not clear up, however, the doctor may make a small cut in the stye in order to drain the pus. This is done under local anesthesia, and oral medications are also prescribed after the incision. And surgery for styes is usually called an incision and curettage, or an INC for short. To prevent styes, it's important that we constantly wash our hands. That's probably important now because of COVID too. To take care with cosmetics, to make sure your contact lenses are clean, and to apply warm compresses, and to clean it regularly with baby shampoo mixed with water as mentioned before, and to manage any blepharitis. And if you have any questions for either me or Angela about pink eye or styes, feel free to contact us. Our emails are listed on this slide.
And here are our sources.
Thank you so much for listening.
Thanks for having us. Have a good one.